Hello and welcome. It's 11 a.m. here in Seoul. I'm Choi Jung-yun at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the COVID-19 outbreak. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation in English. Yoon Tae-ho, the overall officer of disinfection at the Central Disaster Management Headquarters, will be briefing us on the coronavirus situation here in the country. He will fill us in on the number of new infections as of midnight and the efforts that the government is making to contain the virus. To give you a brief idea as we wait, South Korea reported 488 new cases of COVID-19 on Friday, staying above the 400 mark for the fourth straight day. Of the new cases, 467 were locally transmitted. Now let's take a listen.
We have Mr. Yoon Tae-ho, who will be briefing us on the COVID-19 situation here in South Korea. Let us now begin our regular briefing for March 12, Friday. As of today midnight, we have 467 new local infections and 21 new imported cases. Yesterday, we had 10 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. First of all, here are some updates on our quarantine capabilities. Yesterday, we also carried out 64,000 tests on a daily basis, and at the screening centers, we have carried out about 35,000 tests, and at the metropolitan areas makeshift testing centers, we carried out about 28,000 tests. And here are some updates on our medical response capacity. We also have about 500 beds available for the intensive care units, and we also have about 10,000 hospital beds available for people with mild or moderate symptoms, and we have 0 patients waiting to be admitted to the hospitals. And as for the adjustment to the social distancing measures, here are some updates. Starting from the 6th of March until the 12th, we have seen 418 cases as the average domestic cases, and we also see for the 8 straight weeks, that is, we are seeing our daily tally hovering around 300 to 400. And also by region, we see that in the non-metropolitan area, we have the number hovering around 100. However, the situation is different in the metropolitan area, where daily cases hover around 300 on a daily basis, and we thus see that there is a very high risk of infection. And we are also seeing many cluster infections that are related to our day-to-day lives, including office buildings, workplaces, as well as other multi-use facilities and gatherings. So we have been listening to the opinions of many experts, and in order to ensure our full-fledged inoculation and also to curb the further spread of the virus, as well as a possible fourth wave, they also agreed that we need to keep the current social distancing measure. And based on their opinion, we decided to extend the current social distancing measure for another 2 weeks. And the level 2 in the metropolitan area and the level 1.5 in the non-metropolitan area will also be maintained for the next 2 weeks until 28th of March. And also, we will be extending the gathering ban on private gatherings of 5 or more people as well. And in the metropolitan area as well, which also has more risks of COVID-19 infection, we will be intensifying our quarantine inspection. And in order to contain further spread of the virus at workplaces, we will be carrying out an intensive monitoring at the industrial complexes as well as other manufacturing facilities that also employ many migrant workers. And as for the 12,000 facilities that hire the migrant workers, we will be intensifying massive testings and also intensify our analysis of the COVID-19 samples as well. And the pan-government efforts will be also put in place to carry out on-site inspection from next week for the next 2 weeks. We will be looking at multi-use facilities, including department stores, private academies, as well as restaurants, and so forth. We will be carrying out incentive monitoring and inspection, and we will also look look at the vulnerable facilities, and as for their workers, we will be carrying out massive and preemptive testing as well. And we have seen many cluster infections stemming from public bath and saunas here in the metropolitan area. And we also have seen a case where the outbreak also took place at the sleeping area at these public bath places. And to this end, we will be restricting the business operations for these saunas and public bath until 10 p.m. And we will also make sure that these facilities comply with the intensive measures, including social distancing measures as well. And also in the metropolitan area, we will be also allowing the saunas facilities to run here in the metropolitan area as well. And we ask the managers and the owners of these public bathhouses as well as these saunas to comply stringently with the quarantine measures going forward. And we are currently having a prolonged fight against the COVID-19 infection, and to this end, we need to also ease our restrictions that are imposed in our day-to-day lives so that we can carry out long-term quarantine measures. And we also believe that the ban on the social gathering of 5 or more people have been very effective in curbing the further spread of the virus. However, we also had some exceptions that needed to also take place, and to this end, we will also have some exemptions while we maintain the current ban on these private gatherings, and we will be expanding the exemptions to include immediate family members as well as families with children under the age of 6 years of age. And we have considered this age of threshold because they need special care for rearing. However, we believe that we ask you to restrain the number of attendance, even if you have family gatherings, to under 8, because you would also have increase in risk infections if the number gets larger. So if you need to meet with your family members, we ask you to also minimize the number of attendees and also meet without having a group meal or sharing beverages together. And in the non-metropolitan area, which is under the level 1.5 of social distancing measures, we have less risks of COVID-19 compared to the capital area. And to this end, all of the nightlife entertainment venues will have to also comply with the quarantine measures, and they will be exempt from the business hour restrictions under the conditions that they comply with these rules. And until yesterday, we have seen that 546,277 people have been administered with their first dose of COVID-19 vaccine. And we are also expanding the scope of our testing as well. And we also have been carrying out plans to double our daily capacity to carry out the testings, as we reported in the daily briefing on the 7th of March. And we also saw that one patient has spread the virus to at least about 25 people, even though this person had symptoms and this person carried out his or her daily routine. So it is very important that we note that this person could have minimized the infections if he or she got tested sooner. And so if you have any symptoms, we ask you to also get tested as soon as possible. And we believe that this is the best measure to protect your loved ones and yourself as well, and comply with the quarantine measures as well. The government will also make sure to exert our full efforts until we return to normalcy. Thank you very much.
지금부터 질의응답 시간을 가지겠습니다. 배석자분들께서는
That was a government briefing on the COVID-19 situation here in the country. South Korea reported 488 new COVID-19 cases on Friday, the highest in 3 weeks. This brings the accumulated number of COVID cases to over 94,000. We'll wrap up the coverage here, and we'll be back at 12 p.m. Korea time with our midday news with Mark Broom. Bye for now.